Coronary angiography. Coronary angiography involves the injection of a radiopaque substance to help assess the condition of coronary artery blockages, the function of the heart valves, and the pressure inside the heart. What indicates the need for it? When doctors diagnose coronary artery constriction, when heart valves and heart muscle function abnormally, to examine the disease pathology of the blood vessels, to prepare for surgery. Preparation before cardiac catheterization. Avoid water and food for at least 4 to 6 hours. If taking regular medication, consult a doctor whether to continue or stop the medication before the examination. If there is a history of drug allergies or seafood allergies, inform the doctor beforehand for allergy medication consideration. Undergo blood tests such as kidney function tests, red blood cell function, and electrolytes in the bloodstream. Undergo chest X-ray and electrocardiogram tests. Urinate before entering the heart examination room. Examination steps. 1. The wrist and groin area will be cleaned with an antiseptic solution to be sterile, then covered with sterile drapes. 2. The doctor injects local anesthesia at the site where the catheter will be inserted. 3. A small-sized catheter will be inserted through a guiding tube at the wrist or groin area until the catheter tip reaches the coronary artery to be examined. 4. The doctor injects the radiopaque substance into the coronary artery while recording images with an X-ray machine from multiple angles. Patients may feel a warm flush for about 10 to 15 minutes. If there are any abnormal symptoms, such as chest pain or nausea, immediately notify the doctor. After coronary angiography, in case the catheter is inserted through the wrist area will be compressed with a band to stop bleeding for about 2 to 4 hours. When the bleeding stops, the nurse will remove the wristband. Do not remove the wristband without the doctor's permission. You can move and eat normally. In case the catheter is inserted through the groin area will be compressed to stop bleeding for about 15 to 30 minutes. When the bleeding stops, the wound will be sealed with an adhesive plaster to prevent further bleeding. Initially, the wound at the groin will be compressed and restricted with a sandbag weighing about 1 kilogram. Do not bend your leg or sit up for about 4 hours. After coronary angiography, patients can eat and drink normally. Observing the wound for any abnormal symptoms. After 24 hours post-examination, the wound can be exposed to water normally. The skin around the wound may bruise, but will gradually fade. If there is swelling, redness, or fluid leaking from the wound, consult a doctor. Heart Center, Piatai 2 Hospital, 12th floor, Building A. Call 02617-2444, extension 4735 or 4736.